Thanks, Anne. Hi, yes, so I'm Rosalind Reilly, and I'm going to talk today about the real-time suspected suicides surveillance system in Wales and what are we learning about suspected suicides in Wales from this. So this is the approach I'm going to take. I'm going to just tell you a little bit about the real-time suspected suicide surveillance in Wales, which I'll refer to as RTSSS from now on. I'll give you a bit of a background on that for those who don't know about it. And then go into what we're learning about suspected suicides, and I'll just give you some highlights from the latest annual report to cover this point, and then I'll just go over some of the next steps that we've got planned for RTSSS. So just before we go on, I will be talking about some data. The data is sensitive data. Some of you may find it distressing, so it's really important to look after yourself first. I won't be offended if you need to leave, so please leave if you'd like to. There's a list of sources of immediate support here, and I understand there's Samaritans listeners out there as well. So if anybody needs to leave, please feel free to do so. And also, talking about data, it's really important to remember as well that data are people. So when we're talking about population level data, which I will be, it's important to remember that each number is an individual whose death may have been preventable and whose death may be having a significant and enduring impact on others. So it may seem a little cold talking about data, but we do remember that we're talking about people as well. So the RTSSS. So we were set up in Wales from the 1st of April 22. We were commissioned by Welsh Government. We were very lucky to piggyback onto the system established by the NPC, the BTP system. So they did all the hard work, and we just came along, and they very generously allowed us to use their collection templates, and we were able to set up pretty quickly, even though there had been loads of background work by other people like Anne and Claire and Welsh Government. So I came in at a fairly late stage, and a lot of the hard work had been done. But basically, we collect information on deaths by suspected suicide. Charlie made that point. It's about suspected suicide. It's not suicides that are reported by the ONS, where the deaths have gone through the inquest process. So this is just as soon as the deaths happened, they're reported to us. So the information is collected, is received into Public Health Wales every month. And that's about deaths that occurred in the previous month. And we mainly receive the notifications from the 4 Welsh police forces and BTP separately for transport-related deaths using the data collection template already established. But we do get some additional information as well, so we were able to build on the data collection template and the data already received in. But we get information from the Child Death Review Programme, which is also in Public Health Wales. We get information on nationally reported incidents from the NHS Wales Executive, and we get some additional information from the Welsh Clinical Portal as well, particularly about people's use of mental health services, and also cross-checking of information from Network Rail. So we do get some additional pieces of information in, and we're always looking to kind of expand that as well to improve the data quality as much as possible. So we report on deaths that occurred during a stated time period, which provides a timely indication of deaths by suspected suicide. So this compares with the ONS suicide statistics, which are the national statistics, which are published by year of registration. But the actual occurrence of those deaths may have been months or years prior. So it's important to note that RTSSS is surveillance data. So although we're able to provide more timely information than the ONS data, the data is not of as high quality. But it's still a really valuable source, and it just complements the ONS data. It doesn't replace it. So there's a really good slide set on the National Programme website, which if the slide is shared after the conference, there's a link to it at the end. It's about understanding suicide data in Wales and the difference between the RTSSS data and the ONS data. So that's a really useful resource for people who are interested in exploring that a little bit more. So what do we do with the RTSSS data? So there's a few things we do. We produce a monthly report. So we take that to a monthly operational group, where a few my team are on that, the police liaison unit, the suicide prevention regional lead, a national lead, and somebody from the sort of mental health prevention side of things in the NHS exec. We also make this data available to local public health teams. And we also produce maps, which are mapping of location of incident and location of residence. So that enables, when we get any queries, we can quickly look at the map to see if there's anything, any issue in a particular area. And it also it means it's easier to look at the data when it's in map form. So that's something that we did in the last few months, which has been quite helpful. We also produced an annual report, which is publicly available. I won't list when they're published there, but the next one, so the Year 3 report will be due towards the end of this year. And then we also respond to ad hoc queries. So we sometimes get these in and we respond to them if we can and share anonymised data. So just now moving on to some of the findings then from the latest report. So this latest report covers April 23 to March 24 data, and it was published in December. So what we found was there were 350 deaths of Welsh residents, and the rate was 12.4 per 100,000. So the chart there shows the number per month that were reported to us. So it ranged from 21 to 41. So as you can see, the numbers do fluctuate quite a lot month on month, but no particular pattern that we could see from this. We also had 16 deaths of non-Welsh residents. So we collect all the data, so whether a Welsh resident dies in Wales or elsewhere, or whether a non-Welsh resident dies in Wales, because we're interested in it all. But the main analysis in our annual report is about Welsh residents. So we're not fully confident that we would be collecting all the data on Welsh residents at the moment, because if they die across the border, we may not be getting all that information. But as part of our evaluation as we go along, we'll be able to kind of establish how many cases we're missing. But the police do a really good job of collecting all the data when the incident occurs on the kind of Welsh patch. So just looking at age and sex-specific rates now. So the chart shows males and females, so males in blue, females in green. So I'll just talk about males first. So males accounted for 76% of the deaths, and the highest age-specific rate in males was in the 35 to 44 age group, and followed by the 45 to 54 age group. So this is slightly different to, this is similar to what's seen in the ONS data, and it's like the Wales data is slightly different to the England and Wales data as a whole, so it's slightly younger in the Welsh population. When we look at females, that accounted for 24% of the deaths, and again, the highest age-specific rates for females were in the 35 to 44 group, but followed by a younger age group, 25 to 34. So one of the things we looked at was employment status. So this is quite a shocking graph, I think, because it shows such a high rate in people who are unemployed. So the rate of deaths in people who were reported to be unemployed was at least 12 times higher than any other employment status group. Although it should be noted that we didn't have employment status at all for almost a quarter. So that's something that we would like to address in future. But even still, there was enough there to demonstrate that the rate is very high. Just compared to the Year 1 report, it was, again, high, but it was kind of even higher in the Year 2 report. Now, looking at deprivation, Anne mentioned deprivation this morning when talking about self-harm, and it's a similar finding when we look at suspected suicides. So the rate was statistically significantly higher in people who lived in the most deprived areas, so that's the top bar of the chart, and statistically significantly lower in people who lived in the least deprived areas, the bottom chart. And they both, because the black bars do not overlap the orange line, which is the All Wales line, it shows that it's statistically significant. So it's almost twice as high in the most deprived populations compared to the least deprived. And when you compare the data from the Year 1 report, it kind of wasn't as, the difference wasn't as great then, even though there was still a difference seen. So we will have to look carefully when we get to the Year 3 report to see what's going on there. But inequalities do prevail clearly. So we collect a lot of information about associated factors. So I haven't put the chart up here because there are lots of associated factors that we collect. In our report, we only report on if there's 5 or more associated factors reported. But here I've just pulled out the 5 most common. So 5 most common factors identified were mental health condition, previous self-harm, family and or relationship issues, and long-term illness, chronic pain or physical disability, and substance misuse. I'm sure those will be very familiar to many people here. And there were some other findings as well. From the report, we looked at whether a person was known to mental health services. So 29% of people were known to mental health services. Although, again, we had some missing data. 26% we just didn't know. Then we also looked at whether people were known to the police. So this is just, this bullet point is just showing that 37% of people had been suspected or convicted of a crime, and that was ever, so at any time in their lives, and 16% had been the victim of a crime. And location of incident and mode of death was also reported in the report, but I haven't pulled that out here just because of time pressures. So just a couple of points on the limitations of the RTSSS data. So we have limited trend data because we've only published 2 years worth of data, so we can't really compare too much. There are data quality issues for ethnicity, gender identity and sexual orientation. So we do collect the information, but we don't report on it because there are a couple of issues about the quality of the data. For ethnicity, it's not from a source where it was self-reported. And it would be possible to link it for the purposes of research work, but not for real-time surveillance. So there's possibilities of linking data in the future if we can access GP data, but unfortunately not able to do that at the moment. I won't read the other points, but you can see that there's a couple of issues with gender identity and sexual orientation as well. Just moving on because of time. But what does this mean for prevention? So, I mean, a lot of the information I've told you, people already know about. It's either, we know about it from ONS statistics or we know about it anecdotally, but really it just adds to the evidence base, and having it in a more timely way is very useful. Where themes are emerging, we can explore further to improve our understandings. So, for example, unemployment, that came out really strongly. So we're looking now to dig a little bit deeper into that and explore that a little bit more, as well as the sort of known to police side of things in terms of, we have collected data on whether people are known to police in the last 12 months. So that would probably be more useful to look at than what we've already looked at. But we're learning as we go along and getting feedback from people about what they would find useful. And the findings help us to identify any new areas where prevention efforts could be targeted. So the next steps for us are to identify some new data sources. So this is particularly important for hospital deaths where there may be a bit of time between the incident and the death occurring. Exploring some new data sources to get some additional information, for example, immigration status and occupation. Deeper dives, I've already mentioned, and linking cases with ONS data. This is part of the evaluation of RTSSS to see how many of the suspected suicides turned out to be suicides after inquest, and also then how many did we miss. And possibility of using our data for research purposes to be able to answer more questions and to help with our understanding. And also finally, engaging with families bereaved by suicide on their views of RTSSS. We have started to do this. It would be really, we really want to get people's views and also how we should let people know about it, what's the best way. So we think families are obviously the best person to help us with this. That's some further information which will be in the slides if you need to get in touch with us, and the link to the really good document I mentioned about different data sources. And just really quickly, a couple of thank yous, particularly BTP and NPCC, who started this off and allowed us to sort of carry on in Wales, and colleagues in the police who are my team has a really good relationship with the teams in the police forces. We're really grateful for their support. They're really patient with us, and yeah, thank you so much to them and RTSSS team and members of the monthly operation group. So thank you.